President Nixon declared war on cancer back in the 1970s, and by all accounts, cancer's won the war. But what we found is thermography. Cancer is best treated by being avoided. We're finding out that we have the safest methodology out there, what they call angioneogenesis. That's the formation of new blood vessels. What these tumors want is an increased blood supply. And what we're able to detect is the first step that the body makes towards that process of aberrant function that gives the name later on cancer. But long before there's actual presence of cancer, the process has begun. With the use of infrared thermography, we can detect that process the absolute earliest possible.
The reason I joined PTI was when I was looking at something to do in my office that would mesh with my chiropractic philosophy of doing things naturally with the body. I had talked with Dr. Piana about thermography and the ability to detect cancer in the body without the exposure of radiation. I am amazed at what it can do for the women that are having this exam done, and years earlier have the potential of knowing if they have cancer or not. Now there's this huge gap of the 20 to 40-year-old range that there's really nothing that's being generally suggested for early breast cancer detection. With BTI being able to step into that margin, we're providing something that just is not being recommended right now.
Our interpretation services are very satisfactory to all of our members and also our patients. We let them know right away that they're going to get their reports back in 7 days, and they really appreciate that quick turnaround. And recently we were able to implement a 1 business day turnaround.
We're really excited to be part of BTI so that we can reach a broader audience of women in earlier breast cancer detection.
As mammogram has shown, it finds breast cancer when it's been growing for approximately 10 years. And with thermal imaging, they can find it 5 to 10 years earlier. If they're choosing to do thermal imaging, we let them know that it's as an adjunctive therapy, that it's not to take the place of mammography. Well, I have to say that here in Battleground, we have a very large population of families that are very, very large families. So these women are nursing the majority of their lives, easily from 20 years to 50 years old, continually nursing. And to have a mammogram and to have the radiation, we're also finding in that population they don't want radiation. They do want to make sure they have some prevention. I've had a couple patients come to me who have had ruptures from having mammogram. So there's a population out there of women who are very afraid to have a mammogram done with a compression. Thermal imaging is non-invasive, so it doesn't touch the breast.
Hi, my name is Ann Barker, and I am a professional member of Breast Thermography International. I have been a nurse for over 30 years, I've been a massage therapist for over 15, and now my newest passion is doing thermography. And so I educate women about the dangers of radiation. I educate them to the studies that say that mammograms miss many breast cancers, that they give many false positives. I educate them about the benefits of thermography and the studies that prove that this is a very accurate, very sensitive, 97% sensitive screening method. Some of them say that they have talked to their doctors about it and they do get resistance, but they'll just say to the doctor, this is what I'm choosing to do.
My mother recently died a couple months ago of breast cancer, and I feel very strongly that had this been available to her 10 years ago, that she might still be alive today because of the early detection. Because she wouldn't go for a mammogram or traditional testing. But had she had known that there was something that was radiation free, then she would have gone for the testing. You don't go to sleep and wake up and have a tumor. That's not how cancer works. Cancer grows slowly. It's a wonderful adjunct. It's a wonderful, I mean, why not? If one is 85% accurate, another one's 97% accurate, if you combine all three, or you start with one that's non-invasive, doesn't cause radiation, isn't harmful, and it can put up, a little bit of a red flag, then you go on to do other things. Okay, here's the problem. Most women under 40 who find breast cancer, it's because of self-detection, because they've already found a lump. And that is in the later stages. With thermography, the heat will indicate a problem. that then the person can seek out, a clinical correlation.
Well, I have been with actually 3 systems. It's the latest one with BTI, and I feel like I made the best decision with the new camera from ICI and BTI. Remember that thermography is not a diagnostic or a conclusive tool. It is a screening tool that we use with other tools to then make a diagnosis. We're just telling them that there is an abnormality, there's something that does look suspicious, and we need to look at this further.
We chose BTI because of the way that it's gotten so well established. Dr. Piana's work, the literature behind it, the organization, the teaching, the training, the standardization, the credentialing. In our opinion, BTI is the world's leader in breast scanning thermography.
The training that I received has fueled my passion for this subject. I came here to learn about thermography and how we can help people with it, but after listening for a day and a half to the different case studies, to how safe thermography is, my fire is fueled and ready to take this back to Colorado and share it with all the people that we can possibly get.
I'm going full circle. I began my healthcare career at Sloan Kettering back in the 70s doing cancer research. I did tissue culture. Well, after 30 years of research, I discovered thermography. It's the best tool we have for identifying the cancerous process. This is a big breakthrough. We're not treating cancer. We're treating much, much earlier at the initial stages when all we're dealing with is increased blood flow. We are not going to be causing the problem that we're trying to detect. This is absolutely safe. That's why our little ribbon's green, because it's ecology.
I think it's a worthwhile cause, and you have to be passionate about it, persevere, and have fun with it.
I can't say this with enough passion. I truly believe that thermography can and does save lives.
Thermography, as we're saying, is the best answer before cancer. You can find us at btiscan.com.